Schools across the valley are back in session amid dozens of outbreaks in Maricopa County alone. Some schools have quarantined entire classes. One school even shut down. Others are trying to proceed like normal. It's leaving parents wondering how these decisions are being made. Team 12's Michael Doudna has the answer. Michael?
Yeah, guys, each district partnering with the local county health department basically decide on if they will stay open. But if you're looking for specific thresholds, well, you might be disappointed. Class is back in person at the state's largest school district, Mesa, which as of Thursday had 28 cases with outbreaks in 5 of the 6 high schools.
It actually makes me really, really nervous.
Wendy has 2 kids that go to Mesa Public Schools, but this isn't just a Mesa problem. In Maricopa County, 21 schools have seen an outbreak of at least 2 cases of COVID-19.
Each school and situation is going to be a little bit different.
Marcy Flanagan with the Maricopa County Health Department says with different situations, different steps may be taken, all to try and see if they can keep schools open.
Are they able to put other mitigation efforts in place at the school? Are they able to make the classrooms smaller? Are they able to spread out students in the classrooms?
Now, some schools like Santan and Pinal County have shut down after only 6 positive cases. But the difference there was the potential exposure that those cases had.
They would be quarantining more than 60% of the staff. And then several hundred students.
But an important note is that there's no specific threshold on what districts should do with an outbreak. Now, this does allow more flexibility to handle each school's specific conditions, but it leaves parents to have to trust district leaders to make the right health choices.
It does bring on a different level of stress.
Michael Doudna, 12 News.
Michael, thank you. Right now, here are 3 things to know about the coronavirus pandemic here in the U.S. Drug maker Pfizer is planning to start testing its experimental coronavirus vaccine on children as young as 12. The researcher leading the drug trial says parents have already expressed interest in enrolling their kids. This will be the first coronavirus vaccine trial to include children in the U.S. While the death rate from coronavirus is lower among kids, they can still develop serious symptoms. Children can also spread the virus to more vulnerable people. New research suggests that your blood type may determine your chances of being infected with COVID-19 and its severity. Danish scientists compared the blood types of more than 473,000 infected individuals to more than 2 million in the general public. Well, they found those with blood types A, B, and both AB were more likely to be infected compared to those with type O. A separate study from Canada earlier this year came to similar conclusions. The next coronavirus relief bill isn't dead yet. That bill is supposed to be up for another vote as early as next week. Relief money has been stalled after lawmakers were not able to come to an agreement when it comes to stimulus checks and money for education. President Trump called for Republicans to take all talks off the table until after the election, but did say that he would be interested in signing off on some parts of the bill.